Hi, my name is David Montgomery, and today we're going to do an examination of the foot and the ankle. Thanks very much, Joe, for agreeing to be the patient. So to start off the examination, we're just going to start with general inspection. So you need to stand up again for me, Joe. So we're just looking from the front. You want to look to see if there's any deformities of the foot, any erythema or swelling, any toe deformities such as hallux valgus deformity, any hammer toe, claw toes, or mallet toe is not present. You can also look at the arches from the side. You want to look for any pars planus or pars cavus, but it's normal appearance of arches. And then turn around from the back, Joe. So then you want to look at the symmetry of the Achilles tendon. Make sure that one side's not thicker than the other. You can see a normal about 5-degree valgus deformity, which is normal. And you also can look from this, if you look directly straight on from the back, look for the too many toes sign, which would be suggestive when you see more than 2 toes, is suggestive of pars planus. So if you can stand on your tiptoes for me, please, Joe. So from this point of view, you can see that there's good calf muscle bulk, and the Achilles have activated and turned that valgus deformity into a varus deformity, which is normal and relaxed time. And you could also see that the arch reconstituted itself, which is good. Excellent. Now if you can just do a short walk for me, Joe. So you can see I'm back, yeah. So you can see it's good heel toe initiated walking. I'm back, yeah, and it's smooth and symmetrical, and which is good. You can have a seat now. There you go. Lovely. So now we want to move on to a quick neurovascular examination. So in order to do this, we just want to do a quick neurovascular examination. We're just going to check one side rather than both for the purpose of this examination. So we'll check for the posterior tibial pulse, dorsalis pedis pulse, good, and then wiggle the toes for me. Lovely. Then can you feel me touching here?
Yep.
And there?
Yep.
There?
Yep.
There?
Yep.
The same both sides? Yeah?
Yep.
Lovely. And then lift this toe up. Don't let me push it down. Lovely. Now I'm just going to have a look at the base of the foot. So I don't say, oh, you can just about see that. So you want to look at the heel. There's no evidence of damage to the heel. There's 1 or 2 calluses on the top of the foot there. You look in between the toes, each individual toe, looking to see if there's any pathology in relaxed time. Lovely, but they are fine. Okay, so now you want to move on to palpation. So you'll start with the medial malleolus. So you want to palpate over the medial malleolus to see if there's any pain or tenderness. Move down inferiorly to the deltoid ligament, and where it connects into the calcaneal bone. Then move over towards its insertion in the navicular bone. Then on the medial aspect of the navicular bones, also the insertion of the posterior tibialis. Move across the navicular bone to the end spot, which you can assess by lifting the toe up and then the foot up. So it's between extensor hallucis and anterior tibialis, which is the end spot of the navicular bone, a common site of stress fracture. Then move across the mid bones and then across the superior joint line for any tenderness. Move to the base of the 5th metatarsal, which is also the insertion of the perineal tendon and a common site of stress fracture or fracture in ankle sprain. Palpate along the entirety of the 5th metatarsal. Move along the remaining tarsal bones, metatarsal bones, good, for any tenderness and palpation. Then you want to palpate each individual toe. Each individual toe. And lift the leg up, yeah. And then you want to move each individual toe. Make sure there's no pain on the movement. So they're all good, excellent. You also feel the cuboid bone, which is just superior, just in this region here, just superior to the 5th metatarsal, base of the 5th metatarsal. Palpate the calcaneal bone throughout for any tenderness. You also, on the base of the foot, in this point here, just feel in there, which is point specific for plantar fasciitis. It's tender and relax back down. So having completed the palpation, next you want to go through the range of movement. So Joe, if you lift the leg up and then point the toes down as far as they can, so it's about 40-50 degrees of plantar flexion, lift foot up, 10 degrees of dorsiflexion, which is normal. Rotate eversion and inversion, which is normal, lovely. And relax, then point the toes down, so toe flexion and toe extension, that's good. If there's less than 7 degrees of toe extension, that suggests of hallux limitus. Now you want to do the same again with passive range of movement. So put your hand round and cup it, cup the ankle, and then you just move it, and then invert, evert, and you have support there, the calcaneus. Then you can also do the mid-tarsal rotation of the foot, which is normal, it's good, and relax down. So then to complete our examination, we want to go through the special tests. So in order to do that, we're going to start with the anterior drawer test. So lift the foot up, again cupping the calcaneal bone with the tibia in the right hand, pull forward and push back on the tibia for the anterior drawer test, and that's testing for the laxity of the anterior talar fibular ligament. We can also do the subtalar tilt, or the talar tilt, sorry. Again, in this position, just tilting the leg, just feeling again for laxity, which suggests of the calcaneal fibular ligament laxity. And relax down for me. Then the next test is for the anterior tibial ligament, or the tibiofibular ligament, sorry, which is anterior tibiofibular ligament, which is strained the high ankle sprain, and you can palpate it just above the joint line, and if that's tender, then what you can do is the squeeze test. You just squeeze on the fibula and tibia together, and you move up to see the height of the syndesmosis that's tender, the extent of the injury. Similarly, another way to test it is just put it in extreme dorsiflexion and an external rotation, and that puts pressure on the anterior tibiofibular ligament if it's injured. Lovely, thank you. Then the last test we want to do is looking at the Achilles tendon. So you feel on the back along the entirety of the Achilles tendon into the insertion. It's a bit easier if you turn around, Joe. So you want to palpate the entirety of the Achilles tendon into the insertion, and also check for the retrocalcaneal bursa, which is just anterior in here. Good. And then in order to assess that better, Joe, if you sit down again for me. In order to assess for the bursitis, you want to put it into extreme plantar flexion. So that really tries to catch the inflamed bursa if it's present. That's good. And then finally, to complete the test, we do Simmons test. Joe, if you can kneel on the chair for me. So in this position, you squeeze the calf like this on both sides, and if there's no foot movement, then that's suggestive of complete Achilles tendon rupture. All right, good, thanks. So thank you very much. So that completes our examination of the foot and ankle. Thank you.